gleich.
Okay, good evening, everybody. You are present at a EFPC webinar on COVID-19, the experiences from primary care in Europe. And you are many, so that's a good sign. There is interest on how primary care is functioning nowadays in these difficult periods. And so we are happy to share with you some experiences in Europe from different countries, but we would like to have your input in this respect. So that is starting with the rules, and I hear already some voices. What I want to be very strict is that the webcams and the microphones are off. So please switch your microphone off. Mr. Rui Brito. So we are having as less as possible background noise. And you should all be very familiar with all these distancing rules. So I expect this be not a problem for you. My name is Diederik Arendonk. I'm managing this session together with my colleague Pim de Graaf, who will present himself later on. The other rules are that we advise you to use as much as possible the chat box, which is in the right corner, upper corner. The session and the chat box will be recorded, so it will be all presented at our YouTube channel after the meeting is closed. Probably tomorrow morning it will be available. What else to be said? Who we are? We are the European Forum for Primary Care. Some of you will know us. We bring together all the different primary care professionals. So not only GPs, but also the occupational therapist, the pharmacist, social work, you name it. And not only from practice, but also from academic the academics are in, and also the policymakers. So it entails all the different levels of how primary care is developed in Europe. What are we doing? We organize this kind of meetings. We try to exchange knowledge, and so this is one of our key activities. Another key activity we have developed nowadays in this COVID-19 situation is a EFPC survey on the organization of primary care in this difficult period. So we invite you all to provide your input on this survey, which is in the right part of your screen now. The other thing is we try to collect stories, really practical stories of what things are happening. And so if you can write a story from out of your own practice, we would like to see them on our online platform Pi, or otherwise at the Google Docs in the left below corner in your screen. The reason why we are doing this is that we also want to publish and make some statements towards policymakers. And one major issue which we discuss nowadays with our members is what is happening within this health systems in COVID-19 mode, what is happening on collateral damage. And I think that is a very, very important topic because there is not so much attention to it, and a lot of people, in particularly vulnerable groups, are suffering. And not only suffering from COVID-19, but from all kind of other lack of care to them. So if you have any interesting documentation on that, please let us know. Well, having said this, I'm going to hand over to Pim de Graaf, who will be your moderator for this session on the experiences from primary care. Pim, the floor is yours.
Yeah, thank you, Diederik. So welcome all of you, 50 participants now, and a few more are expected. I am a public health consultant, having worked as a GP previously in the Netherlands and associated with the European Forum for Primary Care since its beginning. As you have understood from Diederik's introduction, this webinar is one of the tools of the European Forum to share primary healthcare experiences, information, and knowledge. This is the second webinar we have today on this particular subject. We had an earlier one around noon today, and we plan further seminars on the topic of COVID-19 and primary healthcare in Europe, because that problem is not going away anytime soon, and we think we need to monitor and sustain our involvement in sharing experiences. So the subject is, how does primary healthcare function in Corona times? How does it provide care to patients, and what are the consequences for primary healthcare itself? And that includes the topic previously mentioned by Diederik on the collateral damage done to primary healthcare. So in this webinar, we will share some anecdotal experiences, professional experiences. So this is not a survey or an objective to collect statistical data. This is sharing experience. We have, as you see, many participants, and it's interesting to mention the countries that representatives from countries that are here on participating today. So that is from south to north, more or less. That is Turkey, Croatia, Slovenia, Portugal, a few, Germany, France, Belgium, and quite a lot from the Netherlands, actually. Latvia with a WHO representative, and Sweden. And then we enjoy also participants from other parts of the world, from Canada and from Venezuela and from Senegal even. So we are happy that we attracted that curiosity and interests from people far away. So as I mentioned, since COVID-19 is there to stay for a while, and for several years probably, until maybe vaccination protects so many of us that the outbreak dies down, the question is, how long will we stay with this various degrees of lockdown, and what will that do to the functioning of primary healthcare? So that's actually our theme of tonight. We do have, as a working methodology, we want to show several short videos from colleagues all over Europe, and then start a discussion about the topics they mention. And I will ask some of you to comment on what you have seen. Not to put you on the spot, but because I think it's nice to have some interactive contributions from others working in primary care. So don't be afraid. You can also contribute by the chat, as Diederik mentioned. And so I think let's just start with the first video piece that is from Latvia, and the second one is from Italy. So you get two short videos from Latvia and from Italy, and then we will discuss a little bit about what has been presented there.
Since the threat of coronavirus appeared, there were impressive, challenging changes in the organization and delivery of primary health care focusing on patient and medical staff safety. Now, on the 1st of April, in total, we have approximately 450 infected persons, about 16,000 tests were performed, and 28 patients are hospitalized. 3 of them are in severe condition. Luckily, no deaths are registered so far. Since 16th of March, GPs have major changes in their work. Mainly, patients are consulted remotely, providing telephone consultations, and all team members of primary health care are involved in this work. Patients are still consulted in the practices according to the appointments in case of emergency, if problem cannot be solved on phone, and vaccination is continued all over the country. We try to provide the best possible care for our chronic patients, prescribing medicines on e-health, consultations on acute cases, exacerbation of chronic patients, and since closure of secondary care on routine consultations started, number of workloads has increased. GPs take care of COVID-19 patients as well via phone. We monitor the severity of disease and we provide our advice on treatment. We provide checkups and sick leaves as well. GPs in Latvia face a lack of individual protection devices via short of masks, respirators, and disinfecting agents. Still, in this changing environment, the family doctors are trying to adapt to new conditions, and we are ready to prove that even in situation of pandemic and state of emergency in the country, primary health care can provide universal, holistic, and accessible care for all our patients and continue to provide our services in the best possible quality.
Ti volevo anche chiedere se, oltre all'aspetto lavorativo, forse per quotidiano, sì.
Poi sicuramente c'è un po' di preoccupazione anche il mio mancato il vuoto. Per cui in caso abbiamo una sorta di questo sforzo, in alcuni casi c'è quello comunque la comunicare
Yeah, right. So indeed, the audio maybe is not so very clear. So let me try to summarize for these two short videos the content of what has been said. You see here the second one. This is the GP from Italy, and I will mention then afterwards the content of Latvia. So she talks mainly about the impact on personal life of herself and her colleagues, of course, in primary healthcare, because of the fear not only to be contaminated but also to contaminate family members and at home, and that is quite an issue that she experiences and her colleagues. And she tries even to isolate herself at home, which maybe many others also do. And this is based on the fact that they still do see patients physically, during some home visits, even if they try to limit or reduce enormously the number of home visits they're doing. Most contacts are by telephone, of course. The summary for Latvia is that a little bit the same about the fact that contacts with patients is now mainly by phone, phone consultation, for which consultation hours are scheduled, but still they receive patients physically in their practice if it cannot be avoided. Also patients who come for consultation, do I yes or no have corona. Even they continue vaccinations in their practice, which probably is quite a good thing to do. There is a big fear worldwide that children will worsen, and then you can expect outbreaks of other diseases in future. So in another issue mentioned in the Latvia video is the closure of secondary care practice hospitals, with the result that the workload in primary care increases. That is a phenomenon that we would like to hear from others about this, if you have experienced the same. And is that also creating not only workload for primary care, but also a delay for patient care, patients with cardiovascular or other problems who would actually need that secondary care. That would be an important thing to get some comments through the chat or later on verbally from the participants. And another topic addressed in the Latvia video is the lack of personal protection, personal protective equipment. And we have seen that they use gloves and masks and caps on the head and so on. And there is I think Europe-wide, there is a lack of that material. And not everywhere people use gloves, as you will see in later videos. And what is good practice in terms of protecting yourself and your colleagues? And that is also an interesting topic for us to discuss. The Latvia video actually ends with a positive note. In Latvia, they see the sunshine, and they say we still can provide universal, holistic, and accessible care, but we have to change to adapt primary healthcare. So actually, you could see that as an opportunity for primary healthcare that we go through this period, and we will see later on also if there are other experiences with whereby this crisis and this period actually are an opportunity for primary healthcare. So, is there anyone that I can ask to comment on these topics mentioned, the relations with secondary care, the experiences with limited availability of personal protective equipment, and may I maybe especially ask an experience from Turkey? Is there any Turkish participant who could tell us how that is going on in Turkey? If there is no comment from Turkey, well, I would invite anybody who has a comment or example to mention on these two areas, personal protective equipment and the link or the absence of a link with secondary care at this moment. Don't people go to secondary care? They don't dare to visit the therapist, yeah, the physiotherapist, yeah, right, yeah. All right, that is, yeah, that is also probably the other way around, as we noticed that in hospitals, they do not dare to start up some sorts of secondary care, like surgery, orthopedic surgery, because they say, well, if you do that, there is no physiotherapy afterwards for the patient. So it works direction hospitals, but also the direction of primary care. So hospitals and specialists are wondering at what moment can we start up our regular activities. After hospitalization, of course, people very often need home care, specialized treatment like physiotherapy, etc. So Saskia van der Drift, welcome. Open your microphone, please, and tell us about this.
Well, hi, I'm Saskia and I'm from the Netherlands. One of the main problems that we notice is that our clients, they go to the secondary care, they got their prescription to go to visit us, but the patients, I think they don't dare to go to make an appointment. They don't understand that video consult can be as much as effective as physical consult. And I think this is a real big problem, because in this way secondary problems are rising up, and I really think this is a real big problem, because people don't dare, they don't know, they don't understand it, especially the elderly people, and youngers, they are waiting because they think it will be over soon.
Yeah, that last point, that that is an illusion that we maybe many of us had, but indeed it will not go away anytime soon. And so the problem is that people don't know. Do your hospital specialists know that?
Yes, I send all of them, or I contact them, the geriatrics, the orthopedics, the rheumatology, and the rehabilitation department. I contact them, I spoke with them, I send them the letters and everything, and they say they send clients to us, but the clients really don't dare to go.
Right, yes. Can we hear somebody from Portugal maybe, because we have several participants from Portugal. Is this an issue in Portugal as well? Did you have already experience with this? I think that Portugal was hit rather late by coronavirus, and not sure that the situation now is as it is in Spain, quite serious. So is there anybody from Portugal who can open the microphone and talk about this? Okay, we have maybe, let's see, anybody else from any country, not just Portugal or the Netherlands, anybody who can talk about this effect, that the link with secondary care, patients do not dare to go, do not know that services are available, and that is for general practice, but that's also for physiotherapists and other therapists. In France, it's difficult to have secondary care. A lot of it is not allowed. Can you explain us, can you open your microphone, Mike, and tell us what is not allowed actually? Okay, the microphone is not working on that computer. All right, yeah, thanks. And then you continue communicating by the chat. So all right, so maybe we should then make a next step and go to a next video. So we had one from Latvia, one from Italy. Another one from Italy, the next one will show us actually what happens if you use personal protective equipment during a home visit.
Buongiorno. Prima di mettere il secondo paio di guanti, sistema con un sovrascarpe, cioè il sovrascarpe un po' uscito. Esatto. Prego. Ok.
Okay, this is the PPE video. A general practitioner who is doing a home visit. This is not the same gear you are supposed to use in hospitals. In particular, there are different types of masks. Some are better protecting than others. It's about protecting yourself as a doctor, as a GP or a primary healthcare worker. And other masks are just to protect other people, that you do not contaminate them. So you have different types of that. And I don't think this type is the one that people would normally use in hospitals. But there is, to my knowledge, and maybe if anybody has other information, please share that. There is no common agreement on what kind of masks would be used in primary care and for what. In the Latvia video, we saw that all staff, primary healthcare staff, even after behind their computers, they use masks and gloves and the rest of the equipment. But in other countries, they don't. So that is an area that needs maybe some more discussion and improvement. Well, we don't know at this moment for what kind of home visit this was, but of course you see that the GP enters the home, puts his bag and his items on the floor, and then is donning himself at the whole equipment. Yeah, of course you can wonder what's the best way of doing that, but you have to improvise because you come at people's homes that maybe are small or not really adequate to do this kind of work in this way. And yes, indeed, you see in the chat people exchanging that gear. It's different in every country, and then only if the client has COVID or is suspected of having COVID. But I'm not sure that is the case everywhere, because it's also to protect the client, because you as a primary healthcare worker, you may be a risk for your patients. It's not just that you do not want to be contaminated by your patient. It's both ways. So as primary healthcare workers, and we have seen in Italy and Spain that quite some healthcare staff is actually affected by COVID. Yes, and the equipment is not available. That's true. That is, we hear that also in the videos from Latvia and other videos still to come. So yes, that is an issue. But and that's why we need to communicate that also primary healthcare needs this kind of equipment. And it is time consuming. Yes, it takes the time of a whole home visit. So yeah, that is a challenge indeed. So there's a question whether there is a general agreement what to wear as a GP for home visits. I don't think there are any specific guidelines for that. Also, because of the lack of equipment, and if you make a guideline whereas the equipment isn't there, then of course you create more problems than you already have. By the time there is no shortage anymore of equipment, of this kind of gear, the gloves, the masks, and everything, maybe by that time it would be helpful if we would have evidence-based guidelines for home visits, indeed. Can we maybe we should go to the next video, and that is another one from Italy. Yeah, so and Diederik mentions that the text of what you're going to see will be available after the video, so that even if the audio is not so good, then still you can read it, and I will summarize. So can we now hear the next one from Italy?
Laura.
Ok, cosa fai di mestiere?
Sono un collaboratore di studio presso uno studio di Sesto Fiorentino.
Bene, ti volevo chiedere, com'è cambiato il tuo vivere quotidiano relativamente al lavoro, ma non solo, da quando ci stiamo confrontando con l'emergenza coronavirus?
Per me è cambiato ed è cambiato molto a livello emotivo. Perché anche se al lavoro uno viene volentieri, però quando torna a casa la sensazione di essere stato comunque a contatto con delle persone, dei medici, in realtà un po' di paura io ce l'ho, mi viene leggermente spontaneo di fare ormai da diverso tempo determinati movimenti ripetitivi tutti i giorni, arrivare a casa, togliere le scarpe, mettere sul balcone, il giubbotto lasciarlo fuori, spogliarmi tutti i giorni e mettere tutto a lavorare per paura di avere io qualcosa, di poter farlo ai miei figli, al mio marito, e quindi ecco mi viene anche meno spontaneo l'abbraccio la sera avvicinarmi ai miei familiari, sinceramente.
Grazie.
If the sound was not good, Pim, maybe it helps if you close your microphone when we show the video. But anyhow, let's go on.
So then we see now the text. I hope you can read it. But I think Laura focuses, as a clinical secretary, she focuses on actually the fear of being contaminated. Affects people, and not only primary healthcare workers themselves, but also their family members. And I experienced the same thing when I had been in a hospital in contact with a few corona positive patients. Then suddenly my family became afraid of me. And if this happens for once or twice or a couple of days, it's one thing, but for some people in primary healthcare, this is going on for weeks and maybe even months. And so that you wonder what actually will be the effect on staff of primary healthcare. And we hear also, not from primary healthcare settings, but also from other settings, that hospital doctors do not want to be close to COVID patients or take the risk of being close to COVID patients. And it's maybe a human reaction, but in primary care, where emotions and direct patient contact are essential, that would be a very negative effect on the functioning of primary healthcare. But the question then is, does this indeed happen so often? And then what can be done to support people and to deal with that fear? So if there will be anybody with an experience on that or a suggestion on that, please be welcome. In hospital settings, very often there are counselors, psychological counselors or other types of counselors to help the staff with this. It's not about the patients now, it's about the staff itself. Whether that is available in primary healthcare will be interesting to know. So if there are no comments here, then here we have an example, 24/7 phone number that can be called. That is a centrally organized, or is that hospital based, or is it primary healthcare based? Can you explain a little bit the setup of that? Please open your microphone.
Hello, my name is Tiska from the Netherlands. Can you hear me?
Yes, loud and clear.
Okay, thank you. I work as an occupational therapist, both in primary care and in nursing homes. And there is a 24/7 phone number available for us that we can call, and that is centrally organized by the organization I work for.
That is interesting. So it is your professional organization. It is not a primary healthcare organization or formal authorities, regional or national, but it's your. And do you know if this exists for other professionals in primary healthcare as well?
Yes, it is organized by the company I work for. And it is also, I know of other companies, big healthcare companies in Amsterdam and surroundings, that they also have such an availability of a phone number to be called.
Is this available in any other country? Any participant who knows that this does exist, and maybe does it help? Is it effective to your knowledge? Maybe the experience is not for a long time yet, but is it effective? Helping indeed?
You ask whether or not it is effective. I was not in a position yet to call the phone number, and I have not been in contact with many colleagues, and so I have not asked them whether or not it is effective. I don't know that.
Thank you. Thank you. Well, by the way, there is an interesting suggestion now, or a question. Would testing help more to calm people down, to show that they are negative and corona negative? And would that be a help here? I think that it would not really help, first of all, because you can be tested negative and still be corona positive. The test is giving quite some false negatives in many settings. That is one thing, but also once you are contaminated, and then it takes a while before you find the virus and so for a couple of days and maybe even a week, you still can be tested negative while you have already caught the virus. So I can't imagine that with the quality of the tests, the type of tests we have at this moment, that would be really reassuring in reality. Yeah, so we have another example from the Netherlands. From any other country, any example or experience on mental support, I would say, to primary healthcare staff? Or do you not see the need in a country like Italy, Portugal, Turkey, Sweden, Latvia? Would the WHO representative in Latvia have any experience to share? All right, this is not forthcoming. So I think also for time's sake, we should continue. And then we would now look at a video from Slovenia. And that's a nurse who talks of some of the main experiences.
We are also working a lot now with our Midwives and Nurses Association. With elderly homes, because there we have a lot of problems there also, because there are infections going on also, and they're our most vulnerable patients. And our other elderly homes were not built in a way to do isolation, like cohort isolation. So we are trying to help them and to support them how to do and provide this type of care. We have, like I think everyone now, a big shortage of protective gear. Our government is working hard to get them that it's also safe for our healthcare workers to work. We are all working a lot. Most of the time, the doctor and the nurse in primary care, they're working in shifts. So they're working 1 week in a row, and then they have a week off, and so on and so forth. And in hospitals, they are working for 12 hours because we don't have a lot of staff. And a lot of staff is also in self-isolation because they got in contact with patients who are COVID positive and they didn't know.
Yes. So here indeed is also mentioned, she mentions the self-isolation of primary healthcare workers, and because they may be contaminated by the patient. So this is a serious issue in terms of availability of primary healthcare workers also. And she mentions also, which is interesting, the shifts, that 1 week on, 1 week off. And also in hospitals, she mentions 12 hours shift instead of 3 a day, 8-hour shifts mostly in hospitals everywhere. And that is also something that you wonder, how long can that be sustained? How long can people work with this pressure of 1 week on and 1 week off? So shift change, that is an issue. And then further, you heard her also talk about, again, about the non-availability of PPE, personal protective equipment, also in Slovenia. So that's an issue there as well. So in many countries, I think people experience this in primary healthcare. And the little material you have, how am I going to use it? So maybe this is a problem that is going to pass with the current attempts to provide, to produce and provide many more equipment. But for the past few months, that has been quite an issue, I think, in all countries where COVID has been present already. So is there anybody who would want to comment on that? I still was hoping that we would have a contribution from Turkey. So if there's a Turkish participant, please share with us your experiences that you had over the past few weeks, because we will have also a video from Turkey. And that would be interesting to match that with your experience. So this is another video from Istanbul that's coming up now. And let's see what the emphasis is of this video.
As you see here, there are no patients now. Normally, we have at least 10 patients waiting for doctor visits here. But since our government has advised to stay home most of the time, our patients are much more like waiting at home and very rarely visiting our primary care unit. Let's move. This room is our isolation room for possible COVID-19 cases. Our government's advice is to have the patient wait in a room, and we have an emergency contact, and a vehicle or car comes and takes this patient to the hospital. Let's move on to other units.
Yeah, so this was a clinic attached to a primary healthcare facility attached to a hospital in Istanbul. And so, of course, many of the primary healthcare practices at this moment will have the same, give the same image: empty buildings, empty chairs, no waiting rooms, not filled with patients, and that so that must look quite familiar. One particular issue there is that they prepared an isolation room for patients suspected of COVID, and then the question is, of course, how do you manage the patient flow, even if it is a trickle, if it's just a few a day, and how do you separate suspected from non-suspected patients? Actually, a sort of triage. Do you have a triage in your primary care practice, and are you able to isolate the few patients hopefully you would get suspected with COVID, or can you not do that because of the layout of the building? That is an issue of discussion in many places. Do we do a triage? Can we do a triage? And so what's the drill? How do you do that then? And the other point she mentions is about transporting patients to other facilities, especially for COVID patients, and which raises also the interesting question of how do you organize that transport. We do know that when you transport a patient with an ambulance and that patient is suspected of COVID, you have to clean that ambulance completely, and cleaning completely means a lot of work and it takes a lot of time. So then the question is, how can you organize that? Do you have that kind of ambulance capacity, or do you not have that? So it will be interesting also to hear the coming weeks more from various countries how that is being organized. Let's see in the chat whether there are any new reactions. Yeah, so that's a question that Diederik asked. How do you organize your referrals to secondary care? And do you have a fluent flow of patients to secondary care? And for example, when you have a suspected COVID patient, do you call secondary care and announce there is a patient on the way or not? And actually, whom do you refer? We do know that people with light COVID infections, they stay at home and they do not need hospitalizations. But how do you do that triage as a GP or in a GP practice to decide who's going to a hospital and who can return home and just wait for the disease to pass? So if we have a new participant from Latvia, then it would be interesting to hear some experience on these topics that we just discussed. So that's about the use of PPE and the lack of it in primary healthcare. It's about transport to secondary care. It's about the overall relationship with secondary care, because many functions of secondary care do not exist now. A lot of surgery, for example, is postponed. And so do you have anything to share with us on these items in Latvia? Maybe we are putting people on the spot this way, so briefly after having joined our webinar. So that maybe not an easy thing to talk about directly. So we are getting towards the end of this webinar, in which we mentioned a number of topics that of which we can only share that it is an issue at this moment. We do not have any any complete data to provide evidence, but we do have a series of issues that need to be addressed, like guidelines on the use of PPE in primary healthcare, and in particular also during home visits and home care. And it's also about particular relationships between primary and secondary care that it will be interesting to learn some more. And then, of course, the mental health for primary healthcare workers themselves, which was discussed a few minutes ago. We do know that in some countries, apart from the mental health support through telephone services, they also provide hotel facilities to primary healthcare staff so that they do not have to put their relatives at risk. And this is happening in various countries, and I think also in the Netherlands and Amsterdam. But that is maybe a temporary, a good solution to make sure that people do not have to be anxious to contaminate their relatives at home when they return home after their work. So I think we can watch the last video of tonight, which is another one from a GP in Italy, and he will share with us some of his experiences and his hope for the future.
La maggiore opportunità di telemedicina e telemedicina grazie alle nuove tecnologie che permettono addirittura avere parametri in tempo reale o molte altre cose. E quello che io avrei pensato impossibile meno di un mese fa, adesso mi sembra tutto facile.
Yeah. Maybe this was also not very clear. So as you understand, we are working on our technology for the next webinars. But in summary, I think Tommaso is his name, a GP. He talked about empty clinics and the need to talk through the phone with patients. Many patients do not have smartphones yet or do not know how to use them. And it is not always an easy solution, and it does not really match the quality that normally you have when you have a personal contact with a patient. The other part of the last part of his message actually is there's an opportunity here actually for primary healthcare, at least in Italy, because digitalization of healthcare is something that goes slow in many countries, and this is an opportunity to speed it up, to make sure that primary healthcare is also using optimally digital tools during its work. And that is the optimistic tone we also would want to end this webinar with, asking ourselves the question: what are the opportunities for primary healthcare? All this, what is happening to us right now. So digitalization is one thing, but maybe there are others who can share experiences of other gains actually, and not only the losses that we have at this period through the COVID outbreak. If there would be any other positive experience, please share that with us. And as mentioned, this is not just for now. This is going to stay for quite a while, COVID, with ups and downs, with peaks in the epidemic and maybe low levels. So any experience that we can share with others is useful. So if not today, then after this webinar, you're very welcome to share with us other experiences, and we can organize other webinars once we master the technology a little bit better, other webinars to as a European Forum for Primary Care to share all those experiences. Apart from the other tools that were mentioned at the beginning of this webinar, and that Diederik, maybe you would want to summarize in a minute what these tools are, so that all participants can make use of them.
Yeah, I'm just going back on this one. Oh, so it's in this slide. We do have a lot of activities going on. I started with it, and to start with what we where we ended this webinar about the positive experiences. In the webinars we already held on collateral damage, it was also asked to the participants. We made focus groups for this topic, and even two specific on mental health and care for elderly. And there were really some interesting suggestions made. So having said that, we definitely want to have as many as experiences on collateral damage. Mostly, of course, on the negative side, and it's clear people are suffering, but also the positive experiences are put into hopefully a statement soon from the European Forum for Primary Care, and then later on by a publication, probably in the British Medical Journal, because we had a chief editor in our one of our sessions on collateral damage. Then also our collection of stories. I mentioned it already. It's very nice to collect those stories and to share these, because I think it's providing support for everybody to read what is going on in other countries, in other regions, within other professional groups, how they are coping with certain problems. So that helps to come through this difficult period. You can do that through our Pi online platform, or alternatively through a Google Docs, which has been started by our Latvian colleagues sharing their experience. I think that is what it is. I already in my first remark in the chat box, I mentioned that all the videos are available on our YouTube channel of the EFPC. You can find the YouTube channel through our website. If you scroll down on every page, you find the link to the YouTube channel, and there also these webinars will be posted, and so you can find them back, also the ones on collateral damage or whatever. Having said that, I think that's thank you very much for your attention, and I hope we will be able to organize some other webinars on practical experiences. Probably we have some videos next week on for Austria, and a very comprehensive video on the Ljubljana Health Center in Slovenia, providing care in COVID-19 times. So as soon as we have more clear when that webinar will take place, we will inform you through our channels. Thank you very much, and hope to meet you in reality soon, but otherwise online through these kind of
Thank you for attending, and also for the nice examples on the digitalization of primary healthcare.
Yeah. Thank you very much. Bye-bye.